that find themselves in this bracket of autism, they they associate it with spiritual listen, part of the world in Ghana specific. So how do we go beyond the myth of letting parents get to know that this thing is real? It's a condition that we need to help them come out of it, rather than suppressing them in homes and in schools, so that their potentials will come up, as we've learned that they have good potentials ahead of them, that when we are able to challenge them with tasks and other things, they'll be able to overcome the challenges that they face. Thank you very much.
Right. Thank you very much, Mr. Bosi. Your question is a very good one, and you sound like somebody who is genuinely concerned about what is going on. And so the first thing is that all over the world, if you have a condition that you want to advocate for better conditions, you want to advocate for human rights, because it's a human rights issues. Children who are born with special needs have a right to health, they have a right to live, they have a right to be named, they have a right to be educated, they have a right to be sheltered. And all these rights, first, the government has its responsibility, and then the government, the community, the family, and then other members of the community. Now, these responsibilities obviously are not being taken up, especially by the government, who is a major stakeholder in ensuring that they also enjoy these human rights. And so usually it is the parents and the families and all of us who are concerned who must come together to form strong advocacy groups and team up with media, okay, to constantly talk about, keep the conversation going about autism, not just in the month of April, but all year round. Something is happening, something is going on, something is being talked about, awareness is being created, education is going on. That is how policymakers and people in government who don't know about autism, people who have people who are in the position to make decisions, to influence things so that they can enjoy their rights. These are the only ways by which we can appeal to them. Okay, and most of the work should be done by the families who have their lived experience. What is the stigma that they are experiencing? What are their stories? These are the things that they have to be talking about. But, well, unfortunately, in our environment, there's so much going on for such families. The first thing is the psychosocial support. They have been hit hard with a diagnosis. They are reading a lot about it. They don't know how to cope with the child. Their spousal relationship, that's their marriage, is even on the rocks because they can't agree on how to raise a child. One person is getting ready to quit the job, and that also has financial implications. So all these things are going on. I have a social support group. At least I am 3 different social support groups, all dealing with autism. And I know what goes on in all these 3 groups. Because support groups are very important, also as part of dealing with such families, I encourage people to join the groups, but then nothing is happening on the group. Nothing, absolutely nothing. There's no conversation. There are no meetings. Nobody's talking. Nobody's sharing. And again, like I said, it is because a lot of things are going on for all these families. They have other children that they are trying to also support. Now, how do they do this advocacy work? So in fact, it's a very difficult hurdle that we must jump. And the two major issues are the psychosocial support and the financial support. And you've heard it all through in the past days that the health of the caregiver is very central to the care of the child. The child, and yesterday I heard David talking about ASD level 1, level 2, level 3, which in a medical term will say mild, moderate, severe, because autism is a spectrum. It doesn't matter what level your child is on the spectrum. With children with special needs, for them to get the care that all of us, teachers, and other caregivers want them to give to the child, for them to be able to give that care, they themselves must be healthy. And I'm using the word healthy because they need to be physically fit, mentally fit, emotionally fit, psychologically fit, financially fit. All these fits health. So if they are not emotionally well, they're not psychologically well, and such families struggle to accept the diagnosis. We call something resolution. They never resolve because it's a lifelong condition. Even when they think that, oh, okay, I've come to understand my child has autism, I'll live with it. There will be times where they will have their emotional lows because of some behavior, something that will show up, or another child that they will see who's doing very well, who is their child's age mate. A lot of things will put them in an emotional low. So they never really resolve. How do they do this advocacy? So even for me, and not just me, but even in developed countries, the first people that experts want to help is the caregivers. Before whatever they can do to the caregiver, they do it. Before now, they can't talk about the child. Okay, so what's happening to the child? What level? What this? What that? Because the caregiver should be in a position to take care of the child. Okay, so for me, two issues must be at the front burner of advocacy. That such families must get the financial support, and they must also get the psychosocial support. Financial support because it's very expensive to have a child living with autism. A lot of people don't go to hospital because they're afraid of the diagnosis and what they'll be told to do. For instance, your child is non-verbal, comes to the hospital, we'll tell you, first thing, go have a hearing assessment. In Takrady, you don't have a hearing assessment center unless you travel to Cape Coast. Just even the thought of traveling to Cape Coast from Takrady is so painful to the brain. But you have to do it because you want help for your child. So you do your hearing assessment. Before you'll be referred to a therapist. And now the therapists are all based in Cape Coast Teaching Hospital. You have to go, book the appointment, come back to Takrady. They'll give you a date. You have to go back. If you are going to organize private therapists in Takrady, you are sure that it's going to cost you an arm and a leg. So it's expensive. All the journey, all these things that you are going up and down, they'll ask you to look at the diet of the child. They may ask you to do other things, and it's all money. Now, how do you do it? Okay, so when it comes to advocacy, we must all lend a voice to the issue. We must all be burdened to say that, look, some children are being left behind. Some children are not being treated fairly. Can they also enjoy the piece of the national cake? Can they also enjoy their human rights? Now, who will say it for them? So somebody must say it. And that is why people like me, I'm happy to be doing this, because my greatest motivation for even becoming a medical doctor was because I served, after I left secondary school, I served at New Horizons Special School before I went to university. And so it informed my choice of course to even study in university, because as I worked in those schools, I asked myself, how can I make a difference, because I saw ministers bringing their children, they didn't look happy. I saw pastors bringing their children, they didn't look happy. I saw rich people bringing their children, they didn't look happy. I saw poor people bringing their children, they didn't look happy. And all these people, when they bring their children to the school, they don't even want to pick them up home. I saw all that. And when I asked myself, what difference can I make? And I came into this field, I'm happy that I have made certain contributions and so contributed. And so that's all I can share, that we all have a responsibility. Thank you, Mr. Bossy, for your question.
Thank you, Doc, for the wonderful presentation. All right. Mrs. Labi, you can unmute yourself and ask your question. Mrs. Labi. Mrs. Labi, you can unmute yourself and ask your question.
Good evening, sir.
Good evening.
Please, I would like to ask Doc that is autism as a result of early screen time, as in like maybe a child starts watching TV from 6 months to 3 years. Is it the cause of autism? I want to ask the Doc. Yes.
Thank you. This also is a very interesting question. Okay. So we have the autism spectrum disorder, ASD, which we are even saying that it's not a disorder. It's just a neurological difference. Just the way the fingers are not the same. All of us don't have the same brain, and that's okay. Now that is a different issue. The kind of autism that we see among children who watch screens for very long hours is known as virtual autism. Now that one is reversible, and that one can be addressed much easily than ASD. Okay, so there are two different things. The screen time is creating a lot of autism-looking children. And this is important that we address, because by the age of 3 years, 80% of the child's brain is already formed. So you are going to live to 99 years. Now, 80% of your brain formed when you were 3 years. What is left from 3 years to 99 years? That's why early childhood is very important. And if there's anything to do for a child, it must be treated with the utmost urgency, because as long as the child misses that window period, everything else is on a low scale. Okay, so virtual autism, yes, it can be reversed, but then the child would have lost a lot of time that it could have been used to develop the brain to learn other things and explore. Because don't forget that as the child is exposed to play and multidimensional, the senses, all the senses are stimulated in a multidimensional way. They form a lot of connections in the brain. And these connections are very important for the future, whether your child become a critical thinker, a problem solver, somebody who innovates. It depends on all these connections. Okay, and as they grow, by 4 years, 5 years, they have they lose the brain connections. So the brain connections are already there, they are born with it. So as you stimulate them, they become fixed and firm and consolidated. So the connections that have not been stimulated, it didn't allow the child to play, to run around. The child only watching screen. All those other parts of all those connections that are waiting to be stimulated, they will die off. And when they die off, it will be difficult for the child to now gain those abilities, those skills. So a child is born with many brain connections, and we want all those connections to be quickly consolidated. And look, this even starts in utero. During pregnancy, by 7 months, the child can hear. So you can start stimulating the, but you miss it, you didn't do anything. And then now you give it to your child, and then you do screens, and the child is now talking like a cartoon character. The child is just on the wrong road. And so yes, there's a difference between virtual autism and the difference between autism spectrum disorder, ASD. And the ASD, up to now, we haven't been able to say that it is caused by A or caused by B, even though we know that there are a few associations. And that's the thing we try to tell parents not to do. For instance, exclusive breastfeeding is very important. Feed your child breast milk for 6 months. The first 6 months is because the organs of the baby are not yet mature enough to digest other things. It's such that it is capable of digesting only breast milk. So we say breast milk only. And the breast milk, I keep on telling people that it's like a suitcase that the baby traveled with to the earth. When you are going somewhere, you pack your suitcase, everything is in it. Your toothbrush is in it. Your toothpaste is in it. Your nightie is in it. It's the same. So the breast milk is the traveling bag. Every medicine the child will need, every immunization the child will need at birth, everything is inside. So the child doesn't need anything from anywhere. But unfortunately, some of us would like to go and buy cow milk. We would like to go to the shelves, buy at 6 months, you are going, instead of even giving the child the food that you eat at home, we like to go and buy puree, potato and peach puree on the shelf. All those foods on the shelf, they contain chemicals. That's we have to preserve the puree for maybe up to 5 years. So these chemicals can damage the brain. Okay, so things that are in the environment that we may do that we are not even conscious of can put the child at a risk of later on getting the, we know that autism runs in families. So you can have even triplets, all three of them will have autism. It runs in families. It's a genetic trait there. But then there are also things in the environment. That's why we are talking about galamsey, because the chemicals that are used for galamsey, all these things are harmful to the brain. All of us, our brains are at risk of being that. But for the children, because it's the growing brain, the damage is even more serious than us. And so I hope that I've done justice to your question, Mrs. Labby.
Okay, Doc, thank you very much. Doc, someone is asking in the chat group, he says that, please, Doc, can this condition be directed at birth or in the mother's womb before the child is born? Also, can it be passed on to a child by parents and family genes?
Thank you. So for now, for every child yet to be born, it's hard to say whether the child will have autism. There's no test to know, nothing. But even till 1.5 years, it's hard to say whether a child truly has autism or not. However, clinical experts like us can tell a child is likely to be living with autism even from birth, because that's the thing that we look out for, that we can see. But then if you are going to use a test to now diagnose the child, we delay it to 1.5 to 2 years. And that is when you can confidently say that it is this or it is not this. But I keep on saying that can never give the child a diagnosis. So the child is 7 years or 8 years. So before then, the child is at risk, which means that if we don't put in interventions, the child is likely to be this by 7 years, 8 years. So we have to do something about it. You're at risk. And we have tests that we can do to tell us the severity of your risk. So this risk is so severe. It means that the interventions must be so intense, or the risk is mild. We have to still intervene. But we know that if we intervene at a pace, a certain pace, the child will be fine. Okay, so there's no way we can tell in pregnancy or at birth. However, and I'm careful to say this, scientists have seen an association between parents who are mathematically inclined and autism. So certain parents who belong to certain professions, okay, are at risk of having children living with autism. So these professions are accountants, bankers, engineers, financial experts, people who are always dealing with calculations, auditors. They are always doing things with numbers. As scientists they haven't been able to draw the line. What are the numbers that they work with got to do with their birth? How does it affect their genes? How does it affect the chromosomes that are passed on to a child? So these are questions that we are trying to answer. Having said that, doesn't mean that every banker, every engineer, every financial person will have a child with autism. No. Every computer person, no. But when we do research, we look at associations. And for instance, we find out what profession, what do these children who have autism, most of them, what do their parents do? And this is what they came out with. I hope that I've been able to do justice to that question.
Thank you very much, Doc. Madam Florence AJ, you can unmute yourself and ask the question. Madam Florence AJ.
Okay, good evening.
Good evening.
I think
Good evening.
part of my question has been answered through
right.
your delivery to the next one, but I can you please tell us some of the signs you mentioned there that for you to detect whether a child has autism or not, it has to take like maybe 1.5 years. You can tell, but you said a specialist like you can actually tell from birth. Can you please tell us some of the things we should look out for that when it is not there, it might mean that the child might have autism or not?
Okay. So one of the things that we look out for is eye contact. Okay. Now from birth, the children have vision, and then their vision is not very clear. It becomes very clear, or it begins to be clear by 3 months. Okay. And by 7 months, they even know their name. So they should be responding to name call. When you call them, they should be able to turn to look at you. You are calling your child at 7 months. Your child doesn't even turn, doesn't even know the name. You have to ask questions. Can the child hear at all? And if the child can hear, why is the child not responding to the name? Sorry, my video is off today. As you can even tell from my voice, I am a bit tired, but this is very important. And so forgive me. I'll try to show my face before the end of the program. Okay, so response to name call is very important. the child is not responding to the name. Now, children who are likely to end up also with autism at that early age, you can see that they don't like interacting too much. So even when you play with them, they don't smile. Smiling is very important. From 2 weeks of birth to 6 weeks, a child must start smiling. Even it's not because you are smiling at them, but when they are sleeping, they are smiling. We call it social smiling. They should start doing social smiling. And you find out that these children, they don't smile a lot. They don't smile too much. And they don't interact. They don't enjoy the games. They may play with them. When they start crawling and start walking, they like to be by themselves. Okay. And sometimes because a lot of us don't know how children should behave, we miss it. Okay. By 1 year, 4 months, you should be able to send your child, bring me a diaper, bring me the remote, bring me your shoe. In fact, around that age, the children also point. They like to point. Children who are autistic, they don't point. The children like to bring things to their parents just to share. It's called joint attention. They don't do that. They just are to themselves. If you ask the parents, will a child bring something to share with you? I say no. And they haven't noticed that it's a problem because, like I've said, a lot of us also don't know how children should behave. They like to do things for us to watch them. So they'll call you, Mama, look. And they are doing something. Children with autism will not do all those things. So by 1.5 years, it will be very clear that the child is not on the road that we expect. But then, and maybe the child is not even saying Mama or Dada. It's not talking at all. It's not mentioning anybody's name. And people will say, oh, to be fine, take the child to school. The child will talk. The child is a firstborn, doesn't have people. I'll say, oh, it's a boy. Boys don't talk early. Oh, you cry when you were a child. You didn't talk early. There's something to be told. And all these things will be delaying. And if you come to the hospital, we also can't tell you much because we have to be scientific to say that, okay, come at 1.5, where it will be very, very, very clear whether things have just delayed or there's an issue. So there are red flags. All these things I'm saying are red flags before we actually do a proper diagnosis. We say that there are red flags. Thank you.
Thank you very much, Doc. Madam Labi, you can unmute yourself and ask the question.
Okay. Doc, please, I would like to ask, when a man is diagnosed with oligospermia, then maybe miraculously there's a pregnancy, and then gives birth to a child, and the child is diagnosed with autism, does it have a link? Is it
Does it have a what?
because the man has oligospermia?
A link?
Yes.
Oh, no, there's no such link.
Okay.
There's no such
And
link.
my second question is, I have a ward who can read very well, but has a speech delay. He can read very well for his age, but then he has speech delay. Whatever he sees, he can read, but then he cannot tell you, I want to poo-poo, I want to wee wee, I am hungry, I want to eat food, but then can read. Give him any book, he can read. So when we went for the assessment, the doctor mentioned hyperlexia. I don't know if he can touch on it. I don't know if it's possible he can.
But was the child given a diagnosis of autism?
Yes, she said level 2.
Okay.
So the child was even reading in her office, and she could see for herself that the child can read very well, but then lacks communication.
Yeah. So on the first day, I did a presentation where I talked about the fact that some of these children have very, very, very high, relatively higher levels of intelligence than the other children that we may call regular. And we need to find out how we can help them. So I went through 9 types of intelligence, and there was one that said that the child could be word smart. So they are smart when it comes to words, like reading. Okay. Now, autism is a social communication. It presents a social communication deficit. Okay, so the communication is very, very, very important. So they can be word smart, they can read, but communication is an issue because that's how the condition is. Even when they are verbal, sometimes they still lack communication skills. Okay, so it's not too strange that a child can read and be word smart, but cannot communicate. That's why a speech therapist will be now useful to try to, and not just a speech therapist, you also need an occupational therapist. Both of them need to work together at the same time to try to help the child bridge the gaps, what we may call gaps. Okay. So the child will be holistic. That's why in this conference, we talk about an individualized plan because everybody is different. Every child with autism is different. So the issue is, what are the strengths of this child and what are the weaknesses? And how can we help the child navigate around the two? So speech therapists will start telling you how you can relate to the child, how you must be naming things. In fact, today I was having a conversation with somebody and he was saying that, some parents don't even know that children start learning from the womb. And I said, look, it's a very far-fetched issue. Even some parents don't know that they have to talk with their babies. Some parents don't even know that they have to talk with their babies. You see, meanwhile, in our traditional setting, we talk to dead bodies. When a person dies and I get ready for the funeral, the undertakers, when they go to dress the dead body, they have to ask permission. So as him as say, I am this person, introduce themselves, and I've come to give you a bath and dress you for your burial. So please allow me. We believe all those things, but the baby who is alive, we don't believe that we can talk to the baby. Okay, so we must find out how can we get a lot of our young people to train as therapists, and how can we get affordable therapies, because ideally there should be therapists everywhere, in every hospital. It should be affordable, it should be accessible. Unfortunately, that's not the case. So advocacy must come out with all these things. People must share their experiences. If you don't share experiences, then the assumption is that everything is well. All is well. But all is not well like that. When you book to see a therapist, it can take you 3 months before you see your first visit. And all this time, it's passing. We don't have time with such children. Okay, so yes, it's possible the child can be word smart, and the child must be guided to eventually be independent and in a profession where they can use their word smartness, and then they can also communicate. The social communication deficit will be filled so that they can live a productive life with others. Okay. And I hope that I've made the picture very clear to you, what the goal should be. And when parents have when they can see it this way, they have a goal, then they can guide their actions towards that goal and give the child every opportunity they need. Later on, whoever asks the question, you can take my number from David and let us speak on the side. Thank you.
Thank you very much, Doc. Doc, someone is also asking, I have a child living with autism and is hyperactive. Is there any way I can help aside behavior and occupational therapy?
Okay, so what these therapists do is that they work with the parents to guide them on what they can be doing with their child at home. So if you go to a therapist, the therapist will, your child cannot focus. They'll teach you activities you can do to help the brain. And then, because it's a growing brain, the brain is neuroplastic. Okay. If you do those things, those activities with them, and you don't give up, and you continue, and you do, the brain will be undergoing the transformation. It's not going to happen overnight, but it will happen because the brain is developing. You can have that assurance that because the brain is developing, things will change. Okay. So when they do it with you, now when you come home, you have the responsibility. They will not do everything with you so that your child will be fixed. A lot of the responsibility lies on the family and the parent. That's where the challenge is, because most of the time, other things are also taking the attention of the parents, the family, and they're not able to carry on with these things. So your child is hyperactive. Yesterday or 2 days ago, I heard one of our facilitators. She talked a lot about that. For instance, sugar, processed foods. If you give these to a child living with autism, they'll be hyperactive. Okay, so we have to look at diet. What's the child eating? It's better for a child to eat our natural Ghanaian foods. They're very healthy. But the soft drinks, the cakes, all these drinks and stuff on the market, they don't help. So that is one. The other thing is sleep. If they don't get enough sleep, they also tend to be hyperactive. Okay. And then stress. Are they feeling emotionally loved and cared for? Or they're not feeling too comfortable because of sensory stimulation. They don't enjoy the heat. And now this is very, very hot. So some of the children will respond to the heat, or they'll respond to some smell, some sound. So what is making the child, what is the trigger? Okay, and that's what you should also try to look at. What is the trigger? Is the child hyperactive all the time? Sometimes you have to medicate the child. But the thing is that when the brain is growing, all these medications also impact the children. So most of the time, we would like to do the therapies. We prefer the therapies over the drugs. Then if everything fails, we say, well, let's give. And the drugs are very expensive. So it's not like, hey, doctor, I'm tired. My child, just give my child medicine, let us go. The drugs are expensive. You can't stop. Like, you can't decide that, okay, I've stopped. Just like that. So when you start to stop, it's also another issue. That's the reason why we don't want these children medicated anyhow. And we encourage parents to make time and do their bits. Thank you.
Thank you very much, Doc. Madam Cynthia Awoche, you can unmute yourself and ask the question. Madam Cynthia Awoche. Madam Cynthia Awoche. Okay. All right. If you're not getting Madam Cynthia Awoche, Madam Mrs. Labi, you can unmute yourself and ask the question.
Thank you, sir. Doc, please, back to my first question. About the word that was saying, watch TV from 6 months to 3 years. So, they completely cut down the screen time, and now he has started repeating words. When you say something, he repeats after you. But earlier on, there was nothing like that. So when we completely cut the screen, he now, when you say something, I looked it up, and I think the word was echolalia. Now, when you say something, he repeats after you.
Yeah.
So, can you say that this one is not really autism, but it's rather the you said visual autism or
Yeah,
virtual, or
virtual.
so will you describe this as a virtual autism or autism itself, since there has been a progress when total screen time was cut off?
Okay. How old is the child?
Their child just turned 4 years.
So at
Yes,
4
please.
years, the child should be doing much more than repeating words. Okay, at
Yes.
4 years, the child should be making sentences. At
Yes.
1, you say 1 word. At 2, you say 2 words. At 3, 3 words. 4, you are saying sentences. So
maybe if they had cut the screen time earlier, maybe by now you would have been saying the words as you are saying.
yes, I agree.
It has been 4
So we'll
months
have
now.
to, yes, so we'll have to aggressively intervene to see what progress you can make. But echolalia itself is typical of autism spectrum disorder. I'm not saying that to discourage you,
Okay.
but like I was saying before, that if we see that child now, we will do an assessment, and that assessment will tell us whether this thing is really virtual or it is ASD. The assessment will tell us.
Because before
ASD,
we went for the assessment, he wasn't repeating those words.
yeah,
So it was after the assessment that, like, we have seen progress, that now when he says something, he's able to, like, repeat after you and be more a little conversative than he used to be.
yes. So this child is at risk of autism. I said that before 7 or 8 years, you don't see the child as autism. But every child who shows certain signs is similar to autism, whether it's virtual or not, is at risk. Okay, so we'll find out what is the risk, how severe is the risk. So even if it's virtual and the risk is very severe, it still tells us that the growing brain doesn't have a lot of time to be worked on. And we have to marshal every therapy that we can think about to help the child. Okay, so sometimes you may not find yourself with a professional who knows the various therapies or who knows what to do, and that's unfortunate. That's typically what happens in Ghana. Sometimes you can have a condition that there's a doctor somewhere who can help you, but nobody knows, so you don't get that help. So you meet somebody who says, "Oh, I know this doctor here who can help you," then you go and get that help. Okay, that's why I say that some of you need to contact me privately so that we can have more time. I can ask you more questions, and then I can direct you accordingly.
Okay, so please, I want to know whether the total screen time should continue,
What do you by total screen time?
like cutting off of the screen.
Yes, since you if you agree that you ever expose the child to screen, you see,
Yes,
from birth to 2 years,
from
there
6
should be no
months,
screen time.
because you
So
resume from maternity leave at 6 months, so you leave the child with the mother, with the grandmother. So the child has been on TV. You get home in
good.
the evening, so the child was introduced to TV early because you have
So
to go
the
back
child
to,
needs more interactive
and they are not
programs
siblings
now.
too.
Yes, so the child needs
He's the only child.
so the child needs more interactive programs, And if you talk to me on the side, I can share some interactive programs that will help, like rehabilitate the child who has been affected by screens. Yeah,
Okay. Thank you so much.
you're welcome.
All right. Thank you very much, Doc. Madam Cynthia Awotre, you can unmute yourself and ask a question. Madam Cynthia Awotre.
Hello, good evening.
Good evening.
Thank you very excited. And I've learned what. Thank you. My question
Sorry,
is this.
can you raise
Hello.
your voice a bit?
Okay, there is this child. He has been used to a phone cartoon like that. When you take the phone from him, then the grandmother will be very annoyed. Now, when he comes close to the peers or the friends in the class, you see me running this high temperature, and the grandmother will say, the classroom has an infecting room or something. I want to know. But when we give him that phone for him to watch TV and feed him, it's okay. But when you take it from him, then you see him having this hot body, the temperature will be so high that you can't even control it unless you send him to the hospital. And I'm having that challenge in my class. So since then, he has not been coming to school. The grandmother says it is affecting in the class. And I can't see anything. I want to know. Thank you.
So when he uses the screen, then he'll be okay.
Yes.
So screen addiction is real, and it can present in many, many, many ways. I haven't heard of a high temperature yet, but I know that children who have screen addiction, they can get so angry, they can get frustrated, or throw tantrums,
We sleep.
and
The way the body will be very, very hot.
pardon?
I said when you take it, you just sleep. And when you touch him, see their body, you feel the hotness on his body.
Yeah. So that we are yeah, you may be dealing with screen addiction, and
I suggest you hello. Hello.
Hello, Madam Cynthia.
Yeah. Yes, please.
Yes, please. So are you answered?
Yes.
All right, sure. Thank you very much for your question. And all right, so if you just joined us, this is a consultation with Dr. Nana AC Gaisie. Yeah, she's taking all your questions and she's seated, ready to answer all your questions. If in case you have any internet disruption at your end, you can kindly put your question in the chat box and I will humbly read it out so that Doc can attend to your question. All right. So thank you very much. If you just joined us, today is consultation, a free one, of course, with Dr. Nana Gaisie. All right. Let me see your hand. If you have a question, if you don't have a question too, you can if you can't unmute yourself and ask your question, you can put it in the chat box and then I'll be glad to read it out to you as well. Yeah. All right. So Madam Florence AJ, yes, you can unmute yourself and ask your question. I'm trying to locate Doc. I think internet just went off. So you ask your question
Oh,
and I'll put
all
it
right.
in where when she joins in. All right.
Okay. So I wanted to actually know what time what time is too late for a child who has been diagnosed or yet to be diagnosed with autism. What time is too late for him to see a therapist?
Okay.
I have a nephew. I think when he was a baby, I noticed it, but because I was too young and I was pointing out the errors and all that, they didn't really believe me. But now he's 13 years. It's now that the parents have actually seen the signs. His speech isn't clear. He's 13. His speech isn't clear. His eye contact. He's slow. I think when you ask him a question, he takes time to process what you've asked him, and then before he says it, he's having learning disabilities. So he's always coming last in class. So I think my sister took him to the doctor, and then he was diagnosed. I think they said there's a thread in his head, one is off or something. But he's 13. Is it too late for him to start seeing a therapist, or maybe they can do something at home for him? At what age is it too late for a child to see a therapist?
All right. So thank you very much for your question. Now, in fact, it is never too late for you to start an intervention. You remember Doc said that most of the time, if you are fortunate and you get to see these early signs during the birth, and if they are able to check it at the hospital and know they get to see that your child has a risk of autism spectrum disorder, that will be a plus for you because we are always preaching that early intervention is key. However, if by any means you are not able to get diagnosed earlier, probably maybe your location where you are, the knowledge there or the information on autism there is not well spread, that you get to hear of it later. And then you go for, like, for instance, someone might be living with autism right now, but then the person has no aware of a condition called autism in our part of the country. And then you go to the hospital, maybe probably upon this webinar, you are now informed, and your boy or your boy or girl might be somewhere around 13 years, and now you are informed. You go to the hospital, and indeed they confirm that your child is autistic. That is the time that there's a need for you to come in as soon as possible. So anytime, no matter the time you are being diagnosed, we are saying that it is very important that you go for early diagnosis. Any sign that you think is wrong with your child, kindly do well to take them to the hospital, because most of the time what I've realized about Ghanaians is such that we normally will want to associate everything with superstition, and that we will say, oh, leave it like that. When you were a baby, that was how you were. You weren't talking. You spoke around 10 years. You weren't eating, you weren't communicating, you weren't socializing, you were an introvert. We link things to a lot of things which is not good. So anything that you see which is wrong with your child, it is best that you go for early intervention. And when you do so, as soon as you are being told that your child is autistic or probably has risks of getting autism, then that will be the first day or the first point of your intervention. So no intervention is too late. When you are of the known, when you understand and when you know, then you come in to quickly intervene. As we are saying, there's no cure for autism spectrum disorder. The only thing we can do is to care and manage it. And in the care and managing, there should be the need for you to understand that therapist comes in, interventions comes in, parents comes in, and everybody comes in to support. So your child can be able to overcome certain challenges, but then will not be cured of autism spectrum, this, all that. All right. So I believe that I've answered that question very well. And should we have Doc we are going to give it to her again to answer it for us as well. If you have any question, you can put up your hand, and then I think, good. Doc is here. All right. Doc? Hello, Doc.
Hi. Sorry, David and everyone. I didn't realize my battery was so low. My line dropped.
Oh, sorry.
My battery died. Yeah.
Sorry
I'm
for
back.
that. Sorry for that. All right, Doc. We had a question. Someone who asked, "What is
Okay,
the?"
now let me wrap up with the question I was answering.
All right, sure.
And I was saying that the interactive programs that we suggest to families who want to help their child is so for the child whose grandmother doesn't understand, we should also try to convince about screen addiction and then see how we can get the child to do more interactive stuff that will be more beneficial. Thank you.
Thank you very much, Doc. All right, so I've seen most of your questions in the chat box. Don't worry, I'll read all the questions in the chat box. But then if you should put up your hand, I will call you, okay? So don't worry. Those who have questions in the chat box, don't worry at all. I'll read them out as and when, all right? I've not neglected it. I'll read them out. Doc, in your absence, someone asked, what time is too late for a child to be diagnosed of autism? And when you get to hear that your child is diagnosed of autism, at which point is it too late that you can intervene?
Okay. I would say that there's never like too late because every child has a chance. Okay, if we say too late, we'll be speaking a very discouraging language. But then between 2 years to 7 years, the brain develops very rapidly. Okay, and don't forget that I even said that by 3 years, 80% of the child's brain is developed. 80%. So 20% is for the rest of the life. Okay, and that 2 to 7 years is a very critical window period. It's a window because everything that you want to teach a child, whatever you want the child to become, whatever skill you want the child to build, is best when you teach the child within that age frame. Okay, so if you come with your child at 2 years and we find out the child at risk of autism, you have 5 to 6 more years to work hard as compared to the one who comes when the child is now 6 years of age. Okay, and so, well, you may say that is late, but then we'll still give the child the chance to see how they can help themselves. But usually it's more difficult when the child is go past 8 years, and especially if it's severe autism, it's difficult. It's really difficult. So I hope I've answered the question.
All right, Doc. Someone is asking in the chat box, what should we do to prevent autism during our pregnancy? And what brings about autism in childbirth?
So I wish I had answers to these questions, because if we did, nobody will get autism. But like I've already said, we don't know the cause of autism exactly. We know that it runs through families. And we know that there are certain things in the environment that can also trigger it. And there are certain things that can make it worse. Okay, so for instance, you have a risk of autism already, and then we add the screens. It will really let the child retrogress. So really, there's nothing to do except to obey what the doctors ask you to do. For instance, take your drugs, visit antenatal, do your exclusive breastfeeding, avoid herbs, and I'm sure you'll be okay, because parents are looking for something to blame and somebody's to blame. So if you say, oh, if you don't do this, this will happen, and they'll say, okay. So that's the reason why I have a child with autism, but who has autism. But that's not it. It's more complicated than just that. Mhm. So somebody's saying in the chat that is also the cause of blood groups. I don't understand that. Nanekia, can you unmute yourself and make your point, please?
All right. Doc, someone also asking, please, now said my question is ASD child and neurodivergent child's brain. What is the difference? Yes.
Yeah, so autism itself is neurodivergent. And that's what I've been trying to explain, that it's a different brain. Autism is a different brain. When we conduct studies, we see that the way the brain is connected in the brains of other people who don't have autism is different from the way those who have autism, the brain is connected. And we are saying that it's because there's diversity in life. We are all not the same. In fact, nature doesn't do one thing the same, everything the same. It's hard for you to come by something like that. And sometimes when something is different, we judge. Okay, and that's what we are doing with autism. I'm saying, no, don't judge people who have autism. Let's see it as diversity. And let's accept the diversity. Okay. So that's the difference between, that's actually neurodivergence, is actually what autism is about.
Okay, Doc. Someone is also asking, he says, please, I have a son who has a delayed speech. Even though he can recite rhymes, he smells food before he eats it. Please, how can I help him to stop it? He will be 4 years in December.
So he has delayed speech.
Yes, Doc.
Yeah. So at 4 years, when a child has delayed speech, the first thing I want to do is I want to check the hearing, because not every delayed speech is autism. And smelling food alone, you cannot say that's autism. There's also a criteria for saying something is autism or not. Okay, so the first thing we usually do is check the hearing. Sometimes somebody say, oh, my child can hear because the child hears the poems, can recite the poems. But hearing must be 100% in both ears. So if your hearing is maybe 50% in one ear, 100% in the other ear, we need to know so we can find out what is causing the 50% in the other ear, solve that problem, and see how that will improve speech. Because if you can't hear, speaking is going to be difficult for you. So your hearing must be on point.
Okay, Doc. Someone wants to find out. He says, Doc, please, I have a special need learner. She feels so uncomfortable after her therapy and screams and threw herself about. What can I do to calm her down?
After her therapy, she feels what?
So uncomfortable.
So what therapy is that?
So please, the person who placed the question in the chat box, kindly raise your hand so that I can unmute you so you can have an interaction with Doc. All right, I'm waiting for you to show your hand so that I can unmute you. It says FNDK. FNDK. Let me unmute you so that you can ask Doc your question. Okay, so FNDK. You can unmute yourself. FNDK. FNDK, you can unmute yourself, and Doc is ready for your question. Or hello, FNDK. Okay, so if you're not having FNDK, let me go back to the chat box and then read some questions out. And please, if you just joined, we are having a consultation with Dr. Nana AC Gaisie as part of Mother's Day special celebration. So you can ask Doc any of your questions and she is ready to answer all your questions for you. So FNDK, if you are ready, let me see your hand up so that I can interact with Doc. But as time goes on, let me look into the chat box to see if there are some questions actually here. Okay. So the lady who said that, please, I mean, can it also be cause of a blood group? Doc, someone wants to know if autism can be a cause of blood group pairing.
No, it has nothing to do with blood group. Nothing.
Okay. All right. So Doc has rightly answered it. It has nothing to do with blood group. But Doc, what of sickling?
So it also has nothing to do with sickling.
Hmm.
They are all unique in their own ways.
All right. Thank you very much, Doc. All right. So if you just join us, you can have the opportunity to ask Doc any question that you want to. And then also, if you put up your hand, I'll be able to unmute you and then ask your question. This is coming from, I will mention name. He says that, thanks so much, Doc. I am a facilitator and taking care of one autistic learner. He's been with me close to a year, but he feels very reluctant to write. Please, are there any strategies? I would really wish to help him write.
So writing is usually taken care of by occupational therapists. Okay, you won't get a child because before you write, the child must grip the pencil. He must write. Let me say this, that in our Ghanaian culture, left-handed children suffer a lot. That's why we say they are left-handed. You want them to be right-handed. So we start trying to get them to use the right. They are not left-handed because they want to be left-handed. They are left-handed because the brain is controlling that. So any attempt to try to change that is like telling the brain that I don't want you to go this direction. I want you to go the other direction. And that has a way of affecting many of the children. Okay, so if the child doesn't want to write, we need to find out what are the reasons. I remember that David and the others have been talking about behavior, the ABCs of behavior. We have to really take time to study our children. What is informing the behavior? What is the antecedent? Okay. So we need to see the child. We need to study the child to try to find out what it is. Or we can take the child to an occupational therapist whose work now it is to take care of that and then advise us on how we can get the child to write. Because that's why all these therapists are there to help us solve some of these problems.
All right, Doc. Thank you very much. Madam Esther, you can unmute yourself and ask your question.
Hello, good evening.
Yes, please. Good evening.
Thank you, Doc, for the insightful education. I want to ask if you are pregnant and you delay in taking folic acid, can that also cause that? And that's my first question. Then the second question is, can someone at age 12 start developing or exhibiting trait of autism? Like age 12.
Okay, good
Okay,
question.
thank you very much.
So, yes, your questions are very good. Tomorrow is Mother's Day. I want to say well done to all mothers, especially mothers who have a child with special need. And I want to tell you, don't blame yourself for your child's condition because it's part of the processing of the diagnosis. You want to find out, what did I do during pregnancy? What did I not do? Did I eat some food? And the men are happy. Some men are happy because they also want to blame you. Please never, ever, ever, ever take the blame for any of those things when it comes to autism. Because there is no specific cause for autism. And that's it. So it's about folic acid. Okay. Then the second question, you were asking about the question again.
That she wanted to know if can someone exhibit traits of autism at age 12?
Yeah, 12 years.
Yes,
Good,
please.
good. Yes. So that another characteristic of autism is that the children can have something we call regression. So the child was at 1 year, the child was able to say mama, dada, was waving goodbye, was playful and fun. And the child now 2 years, doesn't say anything, plays alone, doesn't respond when you call the child. I've seen children like that. Even some parents have showed me videos. Say, doctor, look at my child. When the child was 1. Now look at my child. My child is now 2 years. The child has regressed. So regression happens at a very early age. It's autism. Now, as we grow older, and some regression can also be due to illness. Okay, can get a high fever, convulse, and then regress. And regression can happen at any point in life also. You can have an accident and then you regress. Okay. So a child who is 12 years and has regressed, we need to find out what underlies the regression. And I have a child like that too. And who had also been, they've sent the child here, there, everywhere. So eventually the psychologist referred to the physician, and the physician said, no, let's refer to this other doctor. So the child came to me, and so I took my time, found out what happened at birth, what's been going on. And the mother admitted that the child has been a slow learner from childhood. So the child has been slow, but was able to do some things. For instance, the child was potty trained, but then she admitted that the child fell ill not too long before they started getting help. And after the child fell ill, now the child has lost the potty training skill, and it's 12 years, so he can't go to school, and on and on and on. Okay, so that's regression. So this is a child who had some kind of problem going on, but they didn't, even though they now when they tell the story, you can tell that the child was a slow learner, and so there was some issue going on. But the child was coping well. They didn't have problem with social skills, so they were okay. But then, now that the child is 12 and the child has gone back to now like a baby, then they are raising the alarm. So this is a child who had a problem and has regressed, has gone back. And now we know that it was due to an illness. we have to now help the child to relearn the skills that the child lost. You have to go back to help the child, to potty train the child, and even probably see how we can help with the slow learning. Okay, so these things happen. You can have very mild autism and get away with it. Nobody will notice that you even have mild autism. And I think on the first day, I shared the story of this editor in the UK who wrote a story about herself. And she said she never knew she had autism till COVID came. And when her routine was changed and she couldn't cope, then she realized that, oh, so she had autism all this while. But she was coping well. She just had to do what she knew to do. And when I wake up in the morning, I do A, B, C, D. She was doing A, B, C, D, A, B, C, D, A, B, C. When COVID came and now she had to do it X, Y, Z. And she said, I can't adjust. And she said, okay, so this is autism. So the child had a very, so I don't know, it'll be interesting to know more about this child who has regressed. What was going on before? And what happened? And why is the situation like this? When we talk about it, we'll make headway. But then the long and short is that if a child has regressed, the child must now go back to learn all the things, to relearn all the things that they need to learn. And that's a very difficult task to do. But then again, it's possible.
All right.
Thank you.
Thank you very much, Doc. Thank you very much. Madam Mary Akamboga, please, you can unmute yourself and ask your question. Madam Mary,
Okay, please, good evening.
good evening.
Good evening.
Thank you very much. I have a child in my class. He's an autistic child, but according to the mother, she said she had accident when she was barely 3 months. So she was saying maybe the injection she was giving or through the accident, that's why the child is an autistic child. I want to find out whether that is the truth. Thank you very much.
She said she had an accident.
Yes, please. She was barely
And then-
3 months. So she thinks that maybe they gave her some injection or something that caused the problem.
Okay.
Thank you.
Well, a lot of people believe a lot of things. Even Donald Trump believes that it's due to vaccination. So he's investigating because people have told their story of how their child was fine till they went for the vaccine. I won't say what month, but one of the months. So they went in and the child has autism. And so he's investigating it. Let's hope that they find out something.
Okay.
Because, yes, different people can react differently to different things. We just pray that all our children will be vaccinated in peace. But then it's hard to convince people that it is not. But we cannot also say for sure that it is. So it's difficult. Let me relate it to the question that somebody's asking, that if science hasn't found out, can we say it's spiritual?
Mm-hmm.
Yeah, so I'm a scientist, but I'm also a pastor's wife. So I also delve in spiritual things. And I have ever listened to men of God who have said that autism is spiritual. But I say that every sickness, actually, that can be spiritual, from evil forces, evil spirits and all that, medicine will find a name for it. They'll find a name. So as for the name, there'll be a name. What is behind it? So whatever you believe that it is, so long as you're a child of God, I encourage you to pray about it and trust God to move on your behalf. That's all I can say.
Right. Thank you very much, Doc. Madam Ira Efe, you can unmute yourself and ask your question. Madam Ira Efe,
Hello, good evening.
good evening.
Hi, good evening.
Good evening. Yeah, please, the questions I want to ask, I think Doug has answered it already based on the spiritual side of it.
Okay.
Yeah, but
Okay.
I also want to say something small about it. I have a son who will be 8 years in June, and though he has not been diagnosed as autistic child, but throughout our journey to the hospital, we did hearing assessments, we've done MRI, we've done everything, and they were telling us that there's nothing wrong with his brain. So yeah, so what we resorted to therapists, and we've been going for speech therapy here and there. And he was in a special school though, but due to one or two things, because of the fees and this, and so we couldn't afford, we have to withdraw him back. So now I'm in the house with him. And coming to the spiritual, that's what my husband also thought about. He said, no, if we've been going to the hospital, do this, do that, and then he believes it's a spiritual attack. So we also started praying on it. And I don't know whether to say funny enough or what, because he has been for training, but still he won't go. When you put him on the toilet seat, he won't do it. When you said, okay, let me put him on the chamber, he won't. But when you put the pampers on him right now, then he will poo-poo. So I said, my child is heading to 8 years and I can't be doing this, wiping up his removing pampers, this, and so I just told myself, I prayed and I told myself, God should direct me, because I can't do anything without him. I can't go out, I can't do anything. And at 8 years, you are still wearing diaper. So it just recently, I think last 2 months in March, I just said I finished bathing him, so I said no, I will not put pampers on him. I left him. He wee-weed on himself. I changed him. So I figured out that he wants to poo-poo, and I placed him in the chamber. He said no, he didn't poo-poo. So he went for the diaper for me to wear. I said no, today I will not allow you. So I didn't put the pampers on him. I was there when he just pulled my hand and we went to the toilet room, and he sat on it and poo-pooed. From that day, he started going to that place to poo-poo. So I'm now working on his wee-wee, because when he wants wee-wee, I've showed him he have to do so now when he says susu, susu is for toilet and wee-wee. So if it's susu, either I go to the toilet, I let him stand, remove his pants and just pull out his pennies for him to wee-wee. But now when he wants wee-wee, he rather goes to the kitchen to wee-wee. So now I'm working on where you are supposed to poo-poo, where you are supposed to wee-wee. So the spiritual aspect too could be part. And I asked the question of I have a delayed child too, who will be 4 years in December. He smells food before he eats. And anytime I try to stop him or give him the food without not smelling, he will not eat. He will not eat it unless he smells it. And when he smells it and he doesn't like the scent or this, and he will not eat at all. And he will keep on disturbing me, pulling me here and there. I need help. I don't know how to deal with him. Even though now I have a progress with the 8 years, now I'm now facing how to deal with the 4 years too.
Yeah.
Yeah. So,
Yeah,
Doc,
you're doing a wonderful job.
Thank you.
And this is it's a lived experience. I like it when people tell their own stories, because we need to hear from your heart. We need to hear from your heart how you feel. And our heart goes out to you.
Thank you.
I think that you're a wonderful mother and
Thank
you are
you.
doing your best.
Thank you.
Children who are not able to communicate, usually they do gestures.
Yeah.
And so it takes a sensitive mother to interpret the gesture or the cues of the child. Okay. And yes, when everything feels, I believe that prayer should also be beneficial. And this is, I'm saying this without any apologies to anybody, because in mental health, we know that religion plays a very important role. Okay. People who lean on God or their source of spiritual strength, they do better than people who have nothing and nobody. Okay, so yes, as a last resort, and a first and a last resort, let prayer help you. You as you spend time with the child, open your eyes to see what are the cues. What does the child do when the child wants to do this A, B, C, D, and then help the child. There are some the professionals that are on board, David and the other lady, I didn't get her name, but 2 days ago, she did a very good job. They have been trained to help parents deal with some of these nuances. How to help the children do their potty training, how to help the children stop smelling food. All these require some strategies. And I'm sure if you talk to David or the other lady, they'll be able to help you. Give you a few tips. Okay. And sometimes they have to even come to your home and come and help you to do this with the child regularly. It takes a lot of patience to. Okay. So like I said, it takes knowing who to go to with your issue. And that's the sad part, that in Ghana, our health system is such that even when you have a health problem, for instance, as a doctor, if you have a problem, you tell me that, oh, I'm going to this hospital, I can tell you, don't go there. Go to the other one rather. Why? Because maybe they don't have a specialist. And I know that. But you don't know. The ordinary members of the public don't know. All they know is every hospital is a hospital. And that's the sad part, because ideally we should know that if I have an emergency and I go to this hospital, they'll not be able to help me. If I have an emergency, I should go to that hospital instead. All these are critical for accessing our health needs. Okay, so you talk to them and they'll help you. Yeah, because these are not major issues at all. But they are also very annoying if you don't get the answers to them. All right, thank you.
Thank you very much.
Thank you very much, Doc. Madam Josephine Okran, you can unmute yourself and ask the question. Madam Josephine Okran.
Okay. So good evening, and everybody.
Good evening.
I'm a class teacher, and I have this autistic child in my class, a boy who is turning up to 5 years. But he puts on diaper because he can't talk. So he does everything on himself. Then we go change him with time. Of late, his mother says that the doctor says he's growing up, so he shouldn't put on the diaper again. So once a while, we should take him to the washroom for him to wee-wee or for him to, go to toilet. But he's even scared of going to the washroom. The moment you hold his hand to take him there, this boy will start crying massively. Then you have to bring him back. He doesn't want to sit on the pot. And of late, the mother don't also put the diaper in his back. So he was set down without moving on himself, without moving. He gets home. And according to the mother, when he gets home, he will rush and go for the diaper. Then he will be on it or he will put on it. I want to know if it has no health implications, because we have advised the mother that for now, he should bring the diaper. With time prayers, maybe he will change. But the mother says no. He doesn't put it inside again. And he sleeps a lot. And I know that at every human being, after sleeping, when you wake up, the first thing is to weary. So I will quickly rush him, and he will cry as if he missed heaven. So we have to rush him back to the classroom. And when he's in class as well, he doesn't like noise. He covers his ears. And when he comes to school, and sometimes you realize that he's in school, comes late in the morning, he cries, pushes lunch bags on the floor, books on the floor, and hits some of his friends. When somebody is crying or when somebody is making noise, he will just stand up and hit a different person or the one crying, or scratch them with his nails. So it's not easy at all. So I would like to know if solutions that can be given.
Yeah, it's not easy at all.
Yes, please. Thank you.
I don't know if the parents have actually sought help for the child.
There's a therapist that mostly come to the school with a speech, but it's not easy. Even taking him there is not easy. But we are on it. Yes.
So you see, a lot of
and the diaper is very small on him. We have asked the mother to go in for the medium size, but the mother keeps on buying the large size of the children. When he goes to poop on himself, everywhere, because it's too small on him and all his buttocks is there. We are really now. And I would like to know if those with autism too, they naturally have feelings. Because my breast, this boy, the only thing I can use to pamper him a little bit is my breast, holding my breast, lying on my breast, sleeping on my breast. I don't know if their feelings are sexually higher. I want to know.
Let me congratulate you for being such a passionate teacher.
Thank you.
If all the teachers were like you, I'm sure that the world would be a very nice place to live in.
Thank you, Doc.
Yes. So let's start with the fact that this child, so the child I have described is typical autism.
Yes.
There's no two ways about it. This is how they are. And if such a child doesn't get the right interventions, can you imagine how the child is going to be? The child is going to behave like a child who is mad. Excuse my language. But there's no child who is mad. It shouldn't happen that we ever say that a child is mad. But then I've seen children in their teenage, with full autism. I'm telling you, it's not a pleasant thing. And they end up at the psychiatric hospital because they'll poo-poo, they'll put their hand in it, they'll use it to paint their house. The only place that they can be accommodated is the psychiatric hospital, because they'll misbehave, they'll even beat their parents. That's the reason why we talk. That's the reason why we talk about early intervention, early detection, and early intervention. That's the reason. Because if we don't address it, you have lost your child. You have lost your child forever. And that's unfortunate, because in a child who is doing this, the child also has a gift, has a skill that lies untouched. Nobody sees their strengths, because you haven't given the child the opportunity to burst that gift. So that gift is gone. And the child will end up in the psychiatric hospital. Yeah, that's the reality, unfortunately. So the first place a child learns is the home. It is the responsibility of the parents and not you, the teacher. No, the teacher, the therapist that comes to the school. It's not a responsibility. Because how many hours do you spend with the child?
The whole day till closing.
Exactly. You do the whole day till closing.
Yes.
But then you are only one teacher, isn't it?
We are
in the
two,
child's
but
lifetime. Yeah, but I mean in the child's lifetime. Will the child be in your class forever?
No.
Exactly. So the child will be you for a while. We'll go and be other teachers too for a while. Other teachers for a while. But you, the parents, they are with you forever. So you're the first people who have to be. Parents have to be the first people who have to be interested. If the child becomes more aggressive and the child has left your class, you won't face that aggression anymore. But the child will still be in the house. And the aggression will still be in the house with the parents. So parents must be made to understand that they have a responsibility. And the school cannot solve the problem alone. So this child needs intensive therapy because he's 5. He doesn't have a lot of time. And the therapist coming to the school alone will not solve this problem. And like I've been saying, it's difficult to even take the child to the therapist when they come.
Yes.
So you have to advise the woman.
Okay. And the only food he eats is rice. Apart from rice, no food. And he smells his food as well. And he doesn't like water unless sachet waters.
He doesn't like water. He likes only sachet water.
Yes. If you give him bottled water, he will smell and throw it away.
Yeah.
Yes.
So you see, these are the people who need the therapist to really help them. So first, we need to see this child. The child will do a hearing assessment. Then we'll continue. What are the gaps in the speech? What are the gaps in the behavior? What are the gaps? Then they'll start now trying to tell the mother, do this and this and this at home. Do this and this and this at home. Do this and this at home with the child. Then they'll be following up. Okay.
With last question, with such a child, is it advisable to be in the class with the normal kids? Especially sometimes when he's crying and he hits the other kids, he pushes them.
So I was going to talk about the hitting. So yes, typically they hit other children because they don't have empathy. They don't have feelings. They don't know how to feel sorry for anybody.
Okay.
So yes, they can be very they can be aggressive. They'll hit other children, pinch them, bite them, all sorts. And even you, the teacher, they can do those things to you.
Yes, they do.
Because they are not able to tell that this is a teacher, this is a child, this is my mother, this. No, they don't, they can't differentiate.
Okay.
So one of the things that the therapist will do is to try to teach the child empathy. So one of the things that has worked with myself and my patients, those who don't have empathy, one of the things we do is to encourage the parents to get a pet for the child. If the child doesn't have allergies, you can get a cat, you can get a dog, you can get a parrot, you can get a rabbit, you can get a whatever, a squirrel. Get a pet. Or get a plant and then start caring for the animal or the plant with the child. This one works for every child because children have to be taught empathy. If they don't learn empathy, they'll be very, very wicked. So if you have a child who is wicked and doesn't know empathy, these are how things to do. Get the child a pet. So the therapist will guide you on how. So initially when you bring the pet to the house, they can be wicked to the pets. But as they see you stroking it, loving it, talking to it, then now those also start learning it, seeing how you care for the plant, how you talk to the plant. In fact, having a child is a job. It's a full-time job. That is why I always talk about the financial and psychosocial bit. But these two areas, they are very important. If you're not at peace financially, you're not at peace psychosocially, you're always stressed. And that's unfortunate because the society we cannot disappoint ourselves this way. We have to rise up and give such families every support that we can possibly give. Okay, so this child needs serious therapies. Now they also have, because they like the texture of the breast, that one, lots of the children, they want to be around the breast, not because they have sexual feelings, no. It's just the sensory bit of it. So I've seen children, you, the doctor, are taking care of the child. The child come and hold your breast. Come and feel your breast. And that's how they calm down. So we tell the parents, you have to get a toy that's as soft as the breast, so they can hold it and they calm down. Yesterday, they were talking about steaming. Someone to chew straws, someone to hold the breast, someone to hold the buttocks innocently. So get them a toy. Know the texture they love, and they give it to them. Now diet, those who don't eat certain foods, they only eat one food. You need a dietitian. It's a dietitian. Some don't like the food because of the color, because of the taste, because of the texture. So if you as a mother, you notice it and go to the dietitian will help you to plan so that you can give the child a balanced diet, because if you eat one kind of food all the time, you have deficiencies. At the West, the child has to be on multivitamins so that what they are not eating, they can have the multivitamins to take care of it. Because if you leave them to be eating this one kind of food all the time, you know that they will not be well nourished. And I'm telling you, a lot of us may even have mild autism, we don't know. Because we are doing well. We are getting along. And on the other hand too, we don't have to pamper the children. The mother who said she stopped the diaper, and after that she's seen results. It's true. We don't have to feel sorry for children with special needs, because when I feeling sorry for them means we do everything for them. It doesn't help, because now when the child is growing older, it becomes very burdensome for you. Okay, so we support them. We don't try to feel sorry for them, and because when you do that, they can never develop their own potential. They can never do what they're capable of doing. I met a woman one day in a program like this, and then she said a testimony about her child. Let me digress a bit. Her child has Down syndrome. But this is one of the children with Down syndrome. I haven't seen a child like that with Down syndrome. The child is very smart, very much aware of himself, very disciplined. The child falls in line. And so the woman was sharing. He said, parents, do you know what I've been through with my child? He said, first, I made a decision that my child will not be like the other Down syndrome children who are walking around and they have been neglected. And he said, my child will not. So the first thing was a decision she made, a conscious said, no. He's going to do everything that every normal child does. And that was her goal. She was determined. So she said one day she noticed something. It just hit her hard. That's my child. When I say do this, it's just like he can't do it. When I say go and bring cook, he's gone to a fridge, he's going to bring the cook. He said, hey, you understand, go and bring cook. You must understand every other instruction I give you. So they went on that road. He said, hey, when I want this thing done, you have to do it because you understand. You can't understand this one, but I can understand go and bring cook. And I'm telling you, because she didn't give the child space, and the child, even though he has Down syndrome, he's doing very, very, very well. He's different and patu. Okay, so we need to take our time, study our children, take our time, reflect on what is my issue. Like this evening, you're consulting and sharing some of these things and everything. And I'm drawing attention to some of these things. That's all these things that you're saying, there are solutions. It's unfortunate that some of the solutions, they're expensive or they're not accessible. Okay, they're not close to you. They are there, but it's hard to even avail yourself for it. But then I'll say it again that when the child is not 8 years, I always tell my patients, look, kill yourself. You kill yourself because after 8 years, if you don't kill yourself much, you won't feel bad because we know that it will be a bit hard to reverse the situation. But you're not 8 years, whatever you have to do, just do it so that when your child crosses that bridge, you say, okay, I've done my best. I've done whatever I could do. But if you allow people to deceive you, say, oh, I've seen somebody here selling some medicine. Somebody here is sharing a testimony. Oh, somebody here it's gone for deliverance somewhere. Do everything. You don't have anything to lose. Go for a deliverance, but go see your therapist. Do what you have to do. Do everything. Don't leave anything out. So that you not have yourself, you not feel bad about it. And I always say that you take it one day at a time. So as a teacher in the training now, who has said all these things, you have to now take your time and say, how can you pass this information to this mother? Sometimes, and David said it several times yesterday, you don't have to carry that burden in Poe. You can say, oh, direct the person, signpost the person, say, can you go and see this person? Okay, can you call Dr. Gaisie on this number and talk to her? Then you say if you want. Because in trying to explain everything, you may even go and say something that you shouldn't say. Personally, but you say, okay, go and see this person. So now you're a teacher who knows how to direct them to the care that they need. And then we take it off from there. I hope I've been able to answer all your questions.
Yes, Doc. Yes, Doc. Thank you very much for the opportunity. Our time is fast spent. Yes, and Doc has been very grateful to us. I mean, she has done all, and God, we say thank you very much. But then let me quickly sum up all the questions in there. I think there's some questions in the chat I'll sum everything up so that, Doc, you add your closing remarks to it, and then we are done for today. And officially, the conference will end today. All right. So the question is that it says, what about a child who doesn't have any red flag apart always singing? Okay, so apart from always singing and doesn't like loud sound, especially from the blender, she is shy when she is among a lot of people. She would hold close to you when there are a lot of people. Even though she can talk, she wouldn't respond to questions when there are a lot of people. Even though she can talk, she wouldn't respond to questions when there are a lot of people. And then she's 2 years old. Another one is also asking that, he says, hello, doc, please, is there any reason why some children living with autism can talk whilst others can't? And then I think these are the two questions left pending in the chat box. And so please, after those,
Okay.
yeah, sure.
All right. So the 2-year-old doesn't have any red flag, but doesn't like loud sound. So yes, so this 2-year-old, for instance, does she talk? Okay, she talks, but when she's in public, she won't talk. So we'll need to run the assessment on the child. So if any child that we are not sure of, we just run the assessment, which will tell us the risk. Okay. So if we haven't run an assessment, it's hard for me to say. But based on what you have written in the chat, I'll say that this child is 2 years, is too young to be flagged, because at 2 years, they're usually shy. Not every shyness also runs in families. Okay, not every child, they are introverts and they're extroverts, temperaments. So if you have a child who's an introvert, they won't talk in public, they won't want to mingle too much. But when the child goes to school, does she play with other children? When they are doing circle time, does the child take part? When the teacher gives instructions, does the child follow? All these little things are very important before we can say that she doesn't have any red flag. Okay. So whoever it is can chat me on the side if you wanted to talk some more about it. Then the second question says, and I missed one, is ASD a blood trace condition and can it be transmitted to another person through a contact or saliva? Okay, I think I've said it several times that we haven't found the cause of ASD. So I'll skip that one. And then, is there any reason why some children living with autism can talk but others can't? There's no reason. We don't know. We have no answers to that. But then we know of a few things that can delay speech, like the screens. Like the screen, they can delay speech. So maybe your child is even having autism, but it's supposed to be a verbal one, but doesn't have the environment enough to be verbal. The screens have stopped the words. That itself is an issue. So the things that are going on in the environment can also largely affect what goes on. Somebody can I get links to some of the activities or routine cards to download for a special need learner, please? Okay, I think this one is David. It's in David's court. So David, over to you.
All right. Sure.
Thank you very much. Yeah, so all in all, I think that I've said a lot. I won't say anything more than let's identify the children early. If you're not sure, let's just allow them to be assessed by people who know what they are doing, not people who don't know, they'll just guess. Even at a point, people used to tell me that at the Fian Quanta, when they bring their children, there's some doctors will tell them that there's no doctor here who can even take care of your child. While I was there, and that's unfortunate, because then they will go and Roma, and then somebody will say, no, there's somebody there, go. Then before they'll come back, and after that, maybe a year has even passed. Okay, so let's share the resources that we have with others, and let's identify them early so that we can also intervene early. Thank you very much.
Thank you very much, Doc, and God richly bless you for your time and blessing us this evening with such an informative question and answer section. Thank you very much also participants for joining in today. And in fact, today has been more than the previous days. Why am I saying this? Today is an experience, a real life experience with autism spectrum disorder. And we've all heard about some of the experience some of the teachers, parents, and advocates have shared. And we've seen the answers to these questions. Going forward, you might come across some of these questions. That is why there was a need for you to join this session. And you have done that beautifully. We want to say God richly bless you and thank you for your time as well. On that note, as we have heard the closing remarks from our keynote speaker, that is Dr. Nana Gaisie, I'm going to share every bit of information with regards to how you can contact Dr. Nana AC Gaisie and also the other speakers during the week. I can see Mina here as well. I will share Mina's contact with you and every other details of how to get in contact with Mina and also Ashley Gillespie and then myself as well. We are here to serve you and we are here to support your child with autism. This is what we do and this is what we love doing. So feel free to come in and also feel free to link up and we can help that child with autism spectrum disorder. Also, I understand that some teachers want a certificate to add up to their CPD credit or CPD point. Don't worry, as I said, you can have a certificate. Yes, of course, you can have it. So you can either have it via email or via WhatsApp as well. So we are working on it. So yes, keep in touch and then you are going to have your certificate. On that note, I want to say thank you very much. And officially, Hope Foundation Autism Webinar Series 2025 has officially ended. Thank you very much and God richly bless you for being part of this wonderful journey. Now, Doc said that she has a support group, a lot of support group. Yes, I'm going to ask her to share the link to that support group with you as well. And also, Mina has a support group as well. I'm going to share the link so that you can also join as well. And then you can all share your experiences. There will be professionals on this group who are going to also talk about what you are experiencing and also how best you can help your child to thrive in that area. On that note, I want to say thank you very much for your time and God richly bless you. Doc, we are highly appreciable and we want to say God replenish your energy that you have lost during this week. God bless us all. And then for now, since we want to officially close the meeting, can we see your faces so that we will know if some of you are familiar or some of you we might meet around town. And then I will meet all of you. Then we say hi to ourselves. All right. Okay, so can I see your video? Can I see your faces? And then let's unmute ourselves. Okay, let's unmute ourselves and say hi to each other as we end the session. All right. Wonderful.
I'm working somewhere.
Hey, I can see Madam
Hi, hi, hi,
Rosemary.
hi, hi.
I can see Madam Juliana. I can see. Oh wow, beautiful faces. Nice. Nice meeting you. We are hopeful that we'll meet in person one day in a conference
Yeah.
to share our experiences. All right. On that note, thank you very much. And God bless you, bless all of you. Bye-bye
God
for
bless
now.
you too. Bye
Bye. Thank
bye.
you. God bless you.
God bless
You
you.
also,
Bye.
Mr. Apostle,
God
Thank
bless
you. We
you.
what
appreciate what you have done.
Bishop, thank
We
you.
appreciate you.
God bless you. Thank you so much.
God bless you.
Bye-bye.
God bless
Bye.
you. God
God
bless
bless
you.
you.
We appreciate a
Bless
lot.
Bye
God
bye.
bless you.
Okay.